Introduction to cardiology, blood disorders, red blood cell disorders. The changes in the levels of red blood cells can have significant effects on the body's ability to effectively deliver oxygen to the tissues. O2 sat, or percent sat, is the percent saturation, that is, the percentage of hemoglobin sites occupied by oxygen in a patient's blood. Anemia. The size, shape, and number of red blood cells and the number of hemoglobin molecules can have a major impact on a person's health. When the number of red blood cells or hemoglobin is deficient, the general condition is called anemia. There are more than 400 types of anemia. Anemia can be broken down into three major groups: those caused by blood loss, those caused by faulty or decreased red blood cell production, and those caused by excessive destruction of red blood cells. In addition to these causes, various disease processes also can lead to anemias. These include chronic kidney diseases, often associated with a decreased production of EPO or erythropoietin, hypothyroidism, some forms of cancer, lupus, and rheumatoid arthritis. Blood loss anemias. The causes: bleeding from wounds or other lesions, including ulcers, hemorrhoids, inflammation of the stomach, also known as gastritis, and some cancers of the gastrointestinal tract. The excessive use of aspirin or other nonsteroidal anti-inflammatory drugs, such as ibuprofen, can trigger ulceration and gastritis. Also, excessive menstruation and loss of blood during childbirth. Anemias caused by faulty or decreased red blood cell production include sickle cell anemia. Sickle cell anemia is a genetic disorder involving the production of an abnormal type of hemoglobin, which delivers less oxygen to tissues and causes red blood cells to assume a sickle or crescent shape. Iron deficiency anemia is the most common type of anemia and results when the amount of available iron is insufficient to allow the production of sufficient heme. Vitamin deficiency anemia is generally called B12 and folate. Megaloblastic anemia involves the deficiency of vitamin B12 and or folate, often due to inadequate dietary intake. Pernicious anemia is caused by poor absorption of vitamin B12 and is often seen in patients with Crohn's disease. Surgical removal of the intestines or stomach is common in some weight loss surgeries, intestinal parasites, and AIDS. Aplastic anemia is a condition in which myeloid stem cells are defective or replaced by cancer cells, resulting in insufficient quantities of red blood cells being produced. This condition may be inherited, or it may be triggered by radiation, medication, chemotherapy, or infection. Thalassemia is an inherited condition typically occurring in individuals from the Middle East, the Mediterranean, African, and Southeast Asia, in which maturation of the red blood cells does not proceed normally. The most severe form is called Cooley's anemia. Polycythemia. Polycythemia is an elevated red blood cell count and is detected in a patient's elevated hematocrit. It can occur transiently in a person who is dehydrated, when water intake is adequate or water losses are excessive. The plasma volume falls. As a result, the hematocrit rises. A mild form of polycythemia is chronic but normal in people living at high altitudes. Some elite athletes train at high levels specifically to induce this phenomenon. Finally, a type of bone marrow disease called polycythemia vera causes an excessive production of immature erythrocytes. Polycythemia vera can dangerously elevate the viscosity of blood, raising blood pressure and making it more difficult for the heart to pump throughout the body. It is a relatively rare disease that occurs more often in men than women and is more likely to be present in elderly patients, those over 60 years of age. Some platelet disorders or clotting disorders include thrombocytosis. Thrombocytosis is a condition in which there are too many platelets. This may trigger a thrombosis, a potentially fatal disorder. A thrombus is an aggregation of platelets, erythrocytes, and even white blood cells, typically trapped within a mass of fibrin strands. While the formation of a clot is a normal step in hemostasis, thrombi can form within an intact or only slightly damaged blood vessel, adhering to the vessel wall or decreasing or obstructing the flow of blood. Thrombophilia. Thrombophilia, also called hypercoagulation, is a condition in which there is a tendency to form thrombosis. This may be an inherited disorder or may be caused by other conditions, including lupus, immune reactions to heparin, polycythemia vera, thrombocytosis, sickle cell disease, pregnancy, and even obesity. When a portion of a thrombus breaks free from the vessel wall and enters the circulation, it is referred to as an embolus. An embolus that is carried throughout the bloodstream can be large enough to block a vessel critical to a major organ. When it becomes trapped, an embolus is called an embolism. In the heart, brain, or lungs, an embolism may accordingly cause a heart attack, a stroke, or pulmonary embolism. Thrombocytopenia. Thrombocytopenia is a condition in which there is an insufficient number of platelets, possibly leading to ineffective blood clotting and excessive bleeding. Hemophilia. Hemophilia is a group of related genetic disorders in which certain plasma clotting factors are lacking or inadequate or non-functional. Patients with hemophilia bleed from even minor internal and external wounds and leak blood into joint spaces after exercising and into urine and stool. Regular infusions of clotting factors isolated from healthy donors can help prevent bleeding in hemophiliac patients. At some point, genetic therapy will become a viable option. Leukocyte disorders. Leukopenia. Leukopenia is a condition in which too few leukocytes are produced. If this condition is pronounced, the individual may be unable to ward off diseases. Leukocytosis is excessive leukocyte proliferation. Although leukocyte counts are high, the cells themselves are often non-functional, leaving the individual at increased risk for disease. Leukemia. Leukemia is a cancer involving an abundance of leukocytes. It may involve only one specific type of leukocyte from either the myeloid line or the lymphoid line. In chronic leukemia, mature leukocytes accumulate and fail to die. In acute leukemia, there is an overproduction of young immature leukocytes. In both conditions, the cells do not function properly. Lymphoma. Lymphoma is a form of cancer in which masses of malignant T and B cells, lymphocytes, collect in lymph nodes the spleen, and liver and other tissues. In leukemia, the malignant leukocytes do not function properly, and the patient is vulnerable to infection. Some forms of lymphoma tend to progress slowly and respond well to treatment. Others tend to progress quickly and require aggressive treatment, without which they are rapidly fatal.